Welcome to our attendees who have joined us today and to those joining via the recording to the North Simcoe Muskoka Specialized Geriatric Services Practice Short for December 2022. My name is Kim Simpson and I'm one of the Psychogeriatric Resource Consultants with NSM SGS. We're going to start with the land acknowledgement. We are gathering on traditional lands sacred to many Indigenous nations. I would like to acknowledge the traditional territory of the Anishinaabe, which includes the Odawa, Ojibwe, and Potawatomi nations, collectively known as the Three Fires Confederacy, the Haudenosaunee and Wendat nations, and the presence of other First Nations, Métis, and Inuit residing in Simcoe Muskoka territory. Most of us have come here as settlers, immigrants, or newcomers in this generation or generations past. We are all treaty people. As such, we commit to collaborating based on the foundational assumption that Indigenous people have the power, strength, and competency to develop culturally specific strategies for their communities. We are dedicated to honoring Indigenous self-determination, history, and culture, and are committed to moving forward in the spirit of reconciliation and respect with all First Nation, Métis, and Inuit people. We are pleased to provide our practice shorts through Zoom webinar. All participants are muted and videos are off. Please note that there's a chat box at the bottom of your screen for you to share with other participants and a Q&A section where we would ask that you write any questions for the speaker. Today's session is being recorded and will be accessible on the SGS website under the Education tab under Archived Sessions. For those of you who have missed previous practice shorts, you will find the recording in this location. If you're watching the recording, welcome. And a reminder, if you would like to join live, practice short sessions are offered the second Friday of the month at 8:30 a.m. It gives me great pleasure to introduce Alison Jayawira. Alison is a psychogeriatric resource consultant with North Simcoe Muskoka Specialized Geriatric Services. Alison is a registered nurse. She has a passion for supporting older adults and has worked in long-term care. She was the RN team lead for the BSS team for North Simcoe and has experience working in adult day programs and acute care settings. Welcome, Alison.
Thank you very much, Kim. I'm really grateful to have this opportunity to expand on the implementation of person-centered language today. And I encourage any kind of thoughts, questions, whatever throughout. We'll get to those at the end of the day or at the end of the session, and I will be checking the chat box as well. So I wanted to start out today's discussion with the understanding that not one of us is perfect and that person-centered language is evolving and we will make mistakes. In recognition that this is being recorded, I'm mindful that things could change and the language we talk about today may not be person-centered in 6 months' time. Everyone on this call supports people who are living with complexities, and we can really impact the nature of the therapeutic relationship with the language that we use. While we acknowledge their complexities, we want to first recognize the person at the center. As language evolves, I'd love to have you think how your use of it has evolved on an individual level, as a team, as staff working across North Simcoe Muskoka. As we go through this morning's practice short, you may recognize words that you've used, and I don't want for a minute for anybody to feel it badly or any kind of guilt, because we know that this is an opportunity. This is an opportunity for change. As we dig into some material, I'd also like you to have some thought on language you've heard that hasn't sat well with you, and more importantly, to reflect on words you might consider swapping in instead that are more person-centered. So our objectives for today are simple. We want to take a little time discussing person-centered language and review its importance, understand the application of PCL, and discuss ways to effectively put PCL into practice as well. By consciously using language in a more sensitive manner, we can avoid reducing individuals to a series of labels, symptoms, or medical terms. Person-centered language focuses on the person, not on their condition. The use of person-centered language helps us address the fear and stigma surrounding dementia, age, mental health, and other conditions. In so doing, people are more likely to acknowledge, learn, and have discussions about dementia and other chronic conditions. As we consider person-centered language, you might be introduced to preferred person-centered terms that are meant to maintain dignity and respect for all individuals. I wanted to spend a little bit of time here. The Person-Centered Language Guidelines document by the Alzheimer's Society of Ontario highlights the principles of person-centered language. The purpose of person-centered language is to recognize the impact of language on thoughts and actions, to ensure language does not diminish the uniqueness or intrinsic value of each person, and to allow a full range of thoughts, feelings, and experiences to be communicated while supporting the following principles. So personhood. Personhood is a standing or status that is bestowed upon one human being by others in the context of relationship and social being. It implies recognition, respect, and trust. Dignity and respect create positive conditions where the person can live without fear of shame or ridicule, where people are treated with warmth and authenticity, listened to without judgment, and are given opportunities for independence and self-expression. Acceptance and understanding. Accept each person with unconditional positive regard. Accept behavior as a form of communication that expresses unmet needs and emotions. Relationships. Support and preserve relationships, as well as support the person in developing new positive relationships. Recognition and individuality. Recognizing the individuality of each person's unique life experience, personality, culture, values, beliefs, and opinions. And finally, the final principle of person-centered language is relationships of trust. Provide the conditions necessary to satisfy fundamental needs and create a climate of personal growth and understanding by providing a relationship based on trust. In a relationship of trust, the person knows confidences are respected, choice and control are maintained, and the person will not be abandoned. So that's just a quick little overview of the principles of person-centered language. So none of us is ever going to get this right 100% of the time. Sometimes we use words within teams that we've always used, within and across teams that make sense to us. But if we think about the negative impact it could have on the individual, it may not be person-centered, strengths-based, or therapeutic in nature. Instead of these words, there are some suggestions which are more person-centered in nature. And I'll swap those out right now. So in consulting best practice tools and in having discussions with colleagues, these terms are deemed more person-centered. And I won't go through all of them, but I do welcome comments in the chat box. I wanted to talk, first of all, up at the top left corner, looking at that living with frailty piece. There was a scoping review done by Durepos et al. In 2021, looking at conceptualizing and diagnosing frailty. Less is understood, however, about older persons' perceptions of the term frail and the implications of being classified as frail. Classifying or labeling a person as frail could be associated with negative connotations and contributing to age-related discrimination, and can have a direct impact on healthcare utilization. Although it's important to assess frailty, the recommendations within the study suggest the use of person-first language, as well as using strengths-based approach in discussing aspects of frailty. And then I'm going to go down to the bottom right corner and looking at that person's living with diabetes. Recently, in speaking with a specialized geriatric services team member who is living with diabetes, she conveyed that the term brittle diabetic is hurtful, as if she could have stopped the autoimmune response of type 1 diabetes. I quote her saying, "I will need insulin 365 days a year, but that does not mean I am not well controlled and not managing my blood sugars." She went on to say that she likes the term person living with type 1 diabetes. She further states, "I am not my disease, and it does not reflect who I am as a person." So there are many guidelines and tools that are evidence informed as well as informed by lived experience. And I've highlighted a few here. These are used actually by members of specialized geriatric services. And I also note that there are other fantastic best practice documents from other organizations, such as the Canadian Diabetes Association, Parkinson's Canada, as well as the Mental Health Commission of Canada. I encourage you to go to these websites and have a look at the different word swap suggestions that they make. The document on the top left of your screen is entitled Person-Centered Language Guidelines by the Alzheimer's Society of Canada, which was developed in 2017. And it contains a comprehensive list of language to avoid, rationale for why you should avoid the language, but also offers up person-centered language alternatives. To the right, the person-centered language commitment statements, which were co-developed by Behavior Supports Ontario, or BSO, and the Ontario Centres for Learning and Research and Innovation, CLRI, in long-term care. The PCL poster contains 4 commitment statements. 1, see the person first. 2, build trusting relationships. 3, consider all forms of communication. And 4, advocate for person-centered language. There's a pledge that can be signed online as well, where you can go individually or as a team saying that you are going to make the commitment to trial using more person-centered language. Many folks on the call today will have already signed this pledge. The tool on the bottom of the screen is an e-learn put out by CLRI once again in partnership with McMaster University. The course takes approximately 30 minutes at your own pace to complete, and you receive a certificate of completion at the end of it. It offers up fantastic practical means in considering person-centered language. The links are being placed into the chat box right now. For those of you watching the recording, I encourage you to go to the brainexchange.ca or the Alzheimer's Society of Canada to locate these resources. I wanted to highlight as well some documents that have been put out in recent years. In fact, the word swap poster was finalized in 2021, which was also done in partnership with CLRI and BSO. And this poster offers up helpful, useful word swap choices for language that maybe isn't quite so person-centered. And it's categorized into 4 different categories: people, places, actions, items. And it makes suggestions of, for example, instead of violent behaviors, consider using physical expressions of risk, as just a quick example. This is something that can be downloaded and placed up around your workspace. Finally, I wanted to highlight the amazing work that's being done by Behavior Supports in acute care. We know our acute care partners, some of whom are on this call today, are posting this tool in staff areas to remind us all to see the person first. While we may be supporting people living with complexities, they are a person first. So how do I make this work? You may recognize this visual from previous practice shorts when considering the Comprehensive Geriatric Assessment. We all have a discipline, we all have skill and a level of expertise that we bring to our assessment. We all support older adults living with complexities. We can invite someone into a therapeutic relationship, or we can cause harm before we even get started, depending on the language we use. This includes language in our assessments and in our documentation. And so I just want you to consider that as you're working through a comprehensive geriatric assessment. Is this language strengths-focused and person-centered? So let's look into some documentation here, and I'd like you to meet Mrs. Cheng. This is some potential documentation. Mrs. Cheng suffers from dementia and is aggressive with care. When staff provide her with her food, she refuses to eat. Family members are very demanding of staff and refuse to consent to staff recommendations. Although this gives us a picture, it may not provide us a positive, objective picture, and there may be opportunity to use more person-centered language. Having reviewed some of the documentation and the resources, I've bolded some words that are not maybe considered or that are not considered person-centered. And yet we see them at times. We maybe have used them at times. This may be, in fact, an opportunity to reflect and consider how to make this more person-centered. So we have swapped out some of that language, replaced it with more person-centered language. Mrs. Cheng is living with dementia and is physically responsive during care. When staff provide her with food, her food tray, she does not eat. The family members are strong advocates, and a care conference is booked to discuss care strategies. The documentation may still not be perfect, may still require further assessment, but it does utilize the principles of person-centered language. As a clinician, it gives me more information to dig into and to consider with my assessment and in the direction I want to look in a person-centered manner. So I'll invite you, given what we've discussed thus far, to type into the chat box any reflections you may have on what you do when you hear language that isn't person-centered. Maybe in the nurse's station, in report, in rounds, at the day program, family meeting. What do you do when you hear language that isn't person-centered? And I'll be the first to admit, I find this very challenging. So I'll give you a minute just to type into the chat box, if you don't mind, what you do. I should have some music on. Try to paraphrase what the meaning behind the message was using more client-centered language. Thank you, Anita. Fantastic suggestion. Yeah, paraphrase back language maybe. I'll often respond by reframing. Yep, more supportive phrasing. Not much unless it's someone I think, yeah, receptive to my feedback. That might be me, Melissa. I'm not gonna lie. It's tough to really to call into question. You may ask the client privately how they feel about the language being used and what is their preferred language. Absolutely. The most important voice we need to hear is that of the person we're supporting. So absolutely. How does that feel to you when you hear that? Respond to staff member by paraphrasing, summarizing your statement. Yeah, using person-centered language. That's wonderful, everybody. It's hard. I'm with you, Melissa. I find it very challenging in that situation. Uses behavioral quite frequently, and I try and break down. Yeah, so our team uses the term behavioral quite frequently, and I try to break down what exactly the team members mean by that. 100%. It doesn't convey what we're seeing. It's not objective, right, Joanna? So I love that. Yeah, Mary, I see that. I ask what their preferences are, what they want to get, how they want to get things done. Lori's saying the biggest one I hear is diaper and bib. Yeah, and I sometimes talk to them off to the side and provide education so that they don't feel defensive in front of others. Yeah, I love that, Lori. I think off to the side, having a quiet conversation with your colleagues, a mutual respect, and just say, hey, noticed you use the terms diaper and bib, which we know can be kind of infantilizing. Have you considered brief? Have you considered clothing protector? Yeah, those are really good suggestions. And actually that's right in that word swap document that we talked about earlier. So that's wonderful, everybody. Please feel free to keep chiming into the chat box. I'll have a look at it at the end of all this, but I do appreciate your input. So I'll just move us along. So strategies to try, and it would appear that I start every strategies to try off with taking a deep breath, because I think in moments of stress, I am somebody who holds my breath. So just take a breath. Just take a breath. This is an opportunity, not a challenge. This is an opportunity. Recognize that. As many of you suggested, when you paraphrase back, use that person-centered language. Absolutely. That's a wonderful way to help sort of connect, and the opportunity is there, right? And as you'd mentioned too, Lori, try to connect privately first. I think that is a really good suggestion. And that is, again, person-centered when you think of your colleagues, right? that, hey, I noticed you use this language. Can you give me some opportunity or give me some understanding of why you're saying what you're saying? As well, when you're using when you've heard language that isn't maybe quite so person-centered, unpacking it a bit, as you suggested too, Joanna. That's a good suggestion. And I'll just put a plug in too for those practical tools. Share those tools. Put them up, get them up around your workspaces. It's maybe just kind of a gentle reminder sometimes, you know, hey, instead of this, why don't we try this? Or hey, look at this is a human being that we're working with. Let's try to support them. I just noticed something else in the chat box. Modeling proper language can have a good outcome and help. Yep. And so, yeah, you get a kind of an idea of how receptive people are. And maybe if I'm confronted in a large group, I may not be quite so receptive. I'm not going to lie. However, modeling that back to me, I can learn from that. And I can also learn from a private conversation as well, where I'm not feeling put on the spot. Thank you, everybody, for your suggestions, for sure. So, practical takeaways. There we go. I think it was Melissa Lang, when I was contacting her about person-centered language, she said, you know what, I always think person first. And I think what a fabulous way to start off any kind of documentation, any kind of a conversation. There's a person first. There's a person living with quadriplegia, a person living with dementia, a person living with frailty. So it's the person first. It's not that we're defining them by their conditions. I also like the suggestion around make the commitment to change your language everywhere, which I think is a good lesson for me. In a team, you may utilize language that isn't person-centered. Everyone on the team knows exactly what you mean and the spirit in which you use it, but inevitably, likely, that language could slip out into other conversations that aren't within your care team and may damage that therapeutic relationship. So make a commitment in every conversation you're having, you're using person-centered language. Change takes time, but as long as we're always trying to move forward, trying to improve, listening to the people we're supporting, we can learn from this. Be objective. We talk about this all the time. It's to Joanna's point, is in what you say, what you report, what you document. Avoid any documentation that is perceived as value-laden or labeling. Document, speak, whatever is objective. Use those available tools and resources. Can you hang the word swap at the nurse's station or in the staff lounge or in the office? Can you give it to families? Consider doing some of those e-learns. And when in doubt, ask. Ask the person how, as many of you suggested, how they want to be referred to. Ask a trusted colleague. Look for evidence-informed documents. And I'll come back to this. So what can we do to commit to person-centered language? Language changes over time. It's always evolving. Just in the last couple of weeks from our colleagues in the Therapeutic Rec Ontario, we're hearing person-driven instead of person-centered. We're hearing personal expressions instead of responsive behaviors. Our OT colleagues are talking about co-creation approach with persons and their care partners. So whether you've been working 30 years or just starting out, person-centered language is evolving. By being open to change, our language as individuals, we're committing to changing the language and practicing it with our teams. When everyone across healthcare, the healthcare sector is utilizing the same language, the impact will have a positive effect on how people we support feel, how they're viewed, and how they're treated. So I'll leave it there for now. And I know we have a couple of minutes probably for questions. Yeah, I'm just noticing in the chat box here from Julie Carthu, there's many opportunities to incorporate these tools and person-centered language into staff orientations and part of formal education for students. Absolutely. Yeah.
So if you do have any questions for Allison, I would ask you to put them into the Q&A. And as we wait for those questions, Allison, I just want to say thank you. I think lots of participation from the audience today, really highlighting that words do matter. There's some information into the chat box too, in terms of incorporating this in huddles.
Yeah, I like that. Yeah, there's opportunity everywhere, right? To change language and to look at best practice and look at that person-centered language. Yeah.
And I think what resonates with me, very much is the ability that it's an evolution. And so regardless of where we're at, we can try person-centered language and not to get overwhelmed. There's recognition in the question and answer from Melissa Lang that appreciates so much the Geri mental health team who acknowledges strengths.
Yeah, yeah.
Great. So I think if there aren't any questions, feel free to put them in, but I'm mindful of time as well. So thank you, Allison, so much. That was wonderful and a great reminder for all of us. And I love the idea that we can start wherever we're starting and having that safe environment. I want to draw everyone's attention to the next practice short. It'll be January next year. And we have Tamara Noack-Leonard, who's the clinical manager and clinical nurse specialist with NSM SGS, coming to speak about decision-making capacity. As always, this is a free event, but registration is required. And so I encourage you, if you're interested, you could use the QR code on the screen right now, or the registration link will be put into the chat box. This event is happening Friday, January 13th, 2023 at 8:30 in the morning. I'd also like to draw your attention to the regional education sessions that are being offered by the psychogeriatric resource consultants. Registration has opened for our winter sessions from January 2023 to March 2023. And you can take a look on the education tab or education services on the NSM SGS website. I want to draw your attention to the fact that positive approach to care and senior friendly care are both being offered in January 2023. I'd like to thank everybody for attending today, and I guess we'll see you in the new year. So I hope you have a wonderful holiday season and a happy new year.